Hello, everybody, and welcome for coming tonight. I really appreciate everybody coming out tonight. My name is Lanelle Hanly, and I'm an AmeriCorps Community Health Navigator here at Reeths-Puffer Schools. I am working under a grant called Project Healthy Grad that is supported and funded by the Robert Wood Johnson Foundation. Tonight, in addition to thanking all of you for coming, I would like to thank Simeon Frang, who is the principal here at Reeths-Puffer Middle School, for allowing us to use this school and the library. He's standing in the back there. And I'd also like to thank TV 96 for coming tonight to film and hopefully air tonight's program on their Live and Well show. I'd also like to thank Linda Balkema from the Muskegon Health Project for being here and conducting our interviews tonight. Our purpose of holding this event is twofold. First of all, we're here to present information and resources because I think it's very important to be educated to make the proper decisions. Knowledge is always key. The second reason I'm having this is to see if there's a need for a support group in the community. So I don't know if any of you saw it, but I do have a sign-up sheet over here on the front table. If you are interested, please sign up. If we have enough interest, we will work on putting together a support group because there currently is not one in the Muskegon area that I'm aware of. So with that said, I would just like everybody to know that we are not here promoting any one type of treatment over another. We are here just to simply present information. So during the question and answer portion, we'd just like to remind everybody, we're here to respect what anybody else has to present for information. Everybody's different. What works for one person might not work for the other. So we're just here to gain knowledge. So with that said, tonight, we have 4 speakers, and our first speaker tonight is going to be Dr. Dagen, and she is from West Shore Family Medicine, and tonight she will be talking about diagnosis, medications, anything along that topic. So thank you very much.
Thanks. Thank you for the introduction, Lanelle. Like you said, my name is Dr. Dagen. I'm a family medicine provider here in Muskegon. So I'm just going to present some general medical information so that we know more about this disease of ADHD. I want you to notice that on all of my slides, I didn't say ADD or ADHD. I put a slash in between because they are one and the same. So I'd like you guys to just kind of learn that piece of information. But I talk really fast, and I apologize in advance, but I was given 15 minutes to present this big topic, so I want to make sure to get as much information to you guys as I can. And then, of course, any questions later will be around for that. So we'll kind of just dive in. What defines this disease process? How do we as clinicians decide that someone has this? This is a lot of information, and again, I apologize. You can kind of read through this as I talk about it. But typically, you'll have 6 or more symptoms of specifically of inattention, and they have to be present for at least 6 months or longer. Or you can have 6 or more symptoms of the hyperactivity or impulsivity, and I'll show those slides in a second so that makes more sense. But again, the symptoms do have to be present for longer than 6 months. I want to point out that most kids at some point or another have a short time period where they're not going to listen and they're not going to focus, and that's just kids being kids. So if a parent comes to my office and they say, my child is doing terrible in math over the last month, they just failed their exam, we need evaluation, well, we'll probably hold off on that and see how the child does over the next couple months before we jump right into that. Typically, symptoms of this disease present before the age of 7, although we are seeing an emergence of these in later adolescence and early adulthood into our teens. Typically, this is a key. Typically, these kids will be affected in 2 or more settings. So it is not just an issue at home, and it is not just an issue in the classroom. It's typically an issue in both. Or in our older population, if somebody's holding a job, we'll typically see some impairment there. And finally, there should not be any other mental disorder to explain what's going on. So anxiety, depression, we really need to rule all of those things out. So remember I said 6 or more of the symptoms of this type. So this is the inattention type, where sometimes we'll see kids have trouble focusing, they can't really pay attention, you'll try to speak to them and they're not really listening. And so again, I'm not going to read all of those, but you'll notice that there's 8 different criteria and they have to meet at least 6 of those. The other subtype would be the hyperactivity, and that's where when we define someone as saying ADHD, the H stands for hyperactivity, meaning these are the kids that are fidgeting and they can't really sit in their seat very long. They can't really play with other people because they're too busy doing other things. Typically when I see them in my office, that last sentence on there, they're being driven by a motor, is usually pretty classic when they have this specific subtype. And again, they really need 6 or more. I know you're looking at this thinking, well, there aren't that many criteria, but this is actually combined with the impulsivity, where they kind of just blurt out answers or they interrupt things. Oh, okay, I was just making sure. See, this is why I don't like being videoed. And so this is combined. So there are, again, 8 to 9 options that we can kind of look at and say, okay, do these kids meet this criteria? And again, has it been longer than 6 months where they've had the symptoms? Is this really important? I mean, you guys came to get this information, but I was asked to comment on maybe why this disease process is increasing or if it really is increasing. Well, we are diagnosing more of this. There's been a 16% increase in our diagnosis since 2007, which is pretty significant for one disease, especially mostly in childhood. But if you look at the population as a whole in the United States, 3.7% of children are affected. So you think, well, that's not very much, but it's a pretty big increase then. 16% more are being affected, and we're diagnosing more and more. It's noted that boys are more likely to be diagnosed than girls. You can see the statistic difference. And as I had mentioned before, the rates are increasing in our teenagers. We're not entirely sure why. So you guys are probably thinking, well, why are we diagnosing more of this? What gives? I don't know that I have a great answer for that. We are thinking because our criteria, the stuff that I just mentioned before, is so broad and it's been changed over the years to include more and more kids. Or is it because we as clinicians are more aware of it? Is it because the teaching system and the educators are more aware of it? Probably a combination of all of those. The criteria to diagnose this disease is probably going to change. New guidelines are supposed to be released next month, but in the medical world, that means they'll probably be released by the end of the year. And so that is looking like we're going to be able to include even more people in our diagnosis. So whether that's good or bad, it will at least make us more aware and maybe be able to identify them with less of these criteria. But I don't have the newer guidelines out yet. So when we're making the diagnosis, when I am making the diagnosis as a clinician, there are a couple things to kind of weed out and make sure that we're really going to treat the right thing and focus on the right thing. So it's important to look at other things that could kind of mimic ADHD. And so learning disorders are a huge thing. We see that these kids are struggling in the classroom. Educators are sending them our way saying, what's going on? 50% of kids that have ADHD have a learning disorder. So that's really something that's important for us to evaluate, and we work together with the school systems to try to look at that, make sure that we're not missing something, and make sure we're not medicating a child that really is just having trouble reading. So we really have to be aware of that. These other disorders that I mentioned, oppositional defiant disorder is another thing that does start in early childhood, usually before the age of 8. And these are the kids that tend to just get really angry, they don't follow the rules, they kind of deliberately annoy other people, kind of maybe are bullies in school. But it's important to figure out if this is going on versus, of course, if ADHD is going on, because they're two completely separate things and they're treated separately. Conduct disorder is another thing, although in my practice I have not seen this develop in childhood. So this is something we need to be aware of with our older teens, especially as we're seeing more ADHD develop at older ages. And this is really the kids or the adults, I see this in more often, that are purposely breaking the law and violating the rules and just not listening because they don't want to. They know the difference between right and wrong, but they're not following it. And so again, very difficult in childhood years to differentiate. Is it just because the child is fidgety and can't focus to pay attention, or because they're deliberately doing something? And the final thing I want to mention is other mental disorders, which I had mentioned before. This is the most common thing that I think is confused with ADHD. Typically in my practice it's anxiety, although we can't forget about depression. Even at the age of 7, kids do struggle with this stuff. And if we treat these inappropriately by putting them on a medication to help them focus, it can worsen these disorders by about 100 times. So it's pretty important to differentiate. So when I have parents come in insisting that their child be put on medication, I usually put the stop sign up and say, nope, we got to start a little bit back. So